gentlemen, welcome to the main event.
Today, we're diving into the topic of Medicaid reform and how it affects veterans. It's a complex issue, but an important one.
Absolutely. Medicaid is a lifeline for many low-income Americans, including veterans. Any reform could have serious implications.
Right. I think a lot of people assume that veterans are all covered by the VA, but that's not always the case.
Exactly. Not all veterans qualify for VA health care, so Medicaid often fills the gaps, especially for those with low income or disabilities.
With the recent discussions about Medicaid reform, there's a lot of anxiety in the veteran community. Have you seen any specific concerns?
One big worry is about eligibility. If Medicaid tightens its requirements, some veterans might lose coverage, especially those with chronic health conditions.
That's a good point. For instance, think of a Vietnam veteran living on a fixed income who relies on Medicaid for prescriptions and doctor visits.
And it's not just older veterans. Younger veterans, especially those transitioning out of service, may also depend on Medicaid if they're unemployed or underemployed.
There's also the issue of long-term care. Medicaid is the primary payer for long-term care services, and many veterans need those as they age.
True. Nursing homes and in-home care can be incredibly expensive. Without Medicaid, some veterans might have no affordable options.
Some reform proposals suggest block grants to states, giving them more control over Medicaid funds. Do you think that could help or hurt veterans?
It depends. On one hand, states might tailor programs to local needs, but if funding is limited, states could cut services and veterans could be left out.
That's a risky proposition. We've seen in the past that when budgets get tight, optional services are the first to go.
Exactly. And sometimes veterans' needs are considered optional, even though they shouldn't be.
There's also concern about administrative hurdles. If reforms add more paperwork or stricter eligibility, some veterans might get lost in the process.
Right. Navigating healthcare bureaucracy is tough enough already. Adding more red tape could discourage people from even trying.
I read that some advocacy groups are pushing for guaranteed Medicaid coverage for all veterans, regardless of income. What do you think?
It's a strong idea. Veterans have already served the country. Ensuring their health care seems like the least society can do.
Of course, the counter-argument is always about cost. Expanding Medicaid for all veterans would require significant funding.
That's true, but some argue it could save costs in the long run by preventing untreated conditions from becoming emergencies.
Preventative care is almost always more cost-effective. Plus, healthier veterans can contribute more to their communities.
On the flip side, if reforms slash Medicaid, we might see more veterans relying on emergency rooms for basic care.
That puts stress on hospitals and drives up costs for everyone. It's a lose-lose situation.
Exactly. And emergency care doesn't address chronic issues. It's like putting a Band-Aid on a broken leg.
I love that analogy. Band-Aids aren't enough. Veterans need comprehensive, continuous care.
Another aspect is mental health. Medicaid covers crucial services for veterans dealing with PTSD or substance abuse.
And those issues can be invisible. Without Medicaid, some veterans might not get any mental health support at all.
That could lead to higher rates of homelessness or incarceration among veterans, which has broader social consequences.
It's a domino effect. When one support system fails, others start to feel the strain.
Have you heard from veterans about how Medicaid changes have affected them personally?
Yes, some have shared stories about losing coverage and having to choose between food and medication.
That's heartbreaking. No one who serves should have to make those choices.
Others have managed to navigate the system, but only with help from advocates or social workers.
Which brings up another point. Not all veterans have access to advocacy. Some are isolated or don't know where to turn.
Community organizations often step in, but they can't fill every gap. Medicaid is supposed to be the safety net.
If the net has holes, people fall through. It's really that simple.
There's also a rural angle. Veterans in rural areas often have fewer providers, so Medicaid coverage is even more critical.
And if Medicaid reimbursements drop, some clinics might close, making it even harder for rural veterans to get care.
Telehealth has helped a bit, but you still need providers willing to accept Medicaid.
Plus, reliable internet isn't a given in rural areas. It's another barrier that's easy to overlook.
Do you think policymakers are listening to veterans' concerns about Medicaid reform?
Some are, especially those with military backgrounds, but often the veteran perspective gets lost in broader healthcare debates.
That's unfortunate. Veterans' health issues can be unique, especially when it comes to service-related injuries or trauma.
Yes, and navigating both VA and Medicaid systems can be confusing. Clear policies are essential.
Sometimes it feels like veterans are caught in a tangle of red tape with no clear path to care.
That's why advocacy is so important. Without voices pushing for their needs, things can get overlooked.
If you could send one message to lawmakers about Medicaid reform and veterans, what would it be?
Don't forget the people behind the numbers. Every statistic is a real person who served their country.
That's powerful. It's easy to get lost in policy details and forget the human impact.
Policies should reflect our values. Supporting veterans isn't just a budget line, it's a moral responsibility.
Well said. Sometimes the best way to honor service is to ensure support after the uniform comes off.
And that support shouldn't depend on luck or bureaucracy. It should be a guarantee.
Looking ahead, what changes would you like to see in the Medicaid system for veterans?
Streamlined eligibility, increased outreach, and more coordination between Medicaid and VA health systems.
Coordination seems key. When systems work together, veterans don't have to jump through so many hoops.
And maybe some flexibility for unique needs, like specialized mental health services or rehabilitation.
I'd also love to see more education for veterans about their options. Many don't know what's available.
Or they hear so many horror stories that they're afraid to even apply.
That's a real issue. Trust in the system is low, especially among those who've already faced obstacles.
To rebuild that trust, we need transparency and consistent support.
One thing's clear, Medicaid reform isn't just a policy debate, it's about real lives.
And for veterans, it can mean the difference between stability and crisis.
If you're listening and this affects you, reach out to local organizations. Don't try to navigate it alone.
There's strength in numbers. Sharing stories can also influence policymakers.
Before we wrap up, what's one thing you wish more people understood about veterans and Medicaid?
That veterans are a diverse group. Age, background, health, they're not all the same, so one-size-fits-all policies don't work.
Great point. And that healthcare is a basic need, not a privilege.
Especially for those who have already given so much.
Well, this has been a really enlightening discussion. Medicaid reform is complicated, but it's crucial that we keep veterans at the center.
Absolutely. It's about honoring their service in practical, everyday ways.
Thanks for tuning in. We hope this sparks more conversations about how to build a better system for everyone.
And remember, real change starts with informed voices. Let's keep the dialogue going.
A special thank you to MarketUS.com for furnishing us this information from the Stars and Stripes article.
I almost forgot, you can reach them at MarketUS.com or call 954-636-3232.
Until next time, take care and stay engaged.
See you soon.
Thanks for watching. I'm Nancy, your AI avatar. If you like this podcast, you can get one for yourself based on a website, YouTube video, or any source. Contact me to get a customized quote for your content. See you soon.